Hello, and welcome to the November 2nd meeting of the Sedgwick County Stimulus Review Team. Today we will continue looking at public health and social service providers' applications, as well as receiving an update on possible requests that are coming up. Before I toss things over to Brent, I'd just like to take a quick roll call. Hope?
Here.
Brent?
Here.
Dr. Walker?
Present.
Melody?
Here.
Mark?
Present.
And Jane?
Present.
Kyle? Not hearing Kyle. All right, thank you very much, and we'll toss it over to Brent.
Thank you, Aaron, and thanks everyone for joining us this morning. As we've indicated, it looks like we have a fairly light agenda this morning. I want to talk about 3 funding requests that are out there that all of them would be looking at additional funding. Give you an update on hospital capacity and some conversations that are happening there. And then I would let you know at the beginning here that the portal for the intake for receipts and so forth for cities opened last Friday evening, so that's available. So on next Monday's meeting, I would anticipate that we would have a report coming from Shannon or Cassandra, the internal auditors, just to speak to what receipts we receive from cities as they make additional requests for the $15 million that have been allocated to cities across the country. So I'm thinking that with those, they come in, that report will indicate to you that we've looked at the receipts, kind of summarized the types of requests that we've seen, or types of receipts we've seen for expenditures, and then a request for any additional disbursements to the cities.
Brent, how many are there? How many cities?
There are 19 eligible cities in Sedgwick County. There are a total of 20 cities that are all or partially located in the county, but one of them is headquartered in another county, so the federal guidance doesn't allow us to help them.
Okay, thank you.
Okay, let's look at some additional funding requests that we received. The first one would be Central Plains Healthcare, which is Project Access. We've originally funded them $5,252.24. They're requesting an additional $2,910.46 as they were purchasing the IT equipment and so forth for the remote work. They spent more than what they had requested, so that's what the additional $2,910.46.
I move approval of their request.
I'll second.
No.
It's been moved and seconded to approve an additional $2,910.46 for Central Plains Healthcare, also known as Project Access. All in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion passes unanimously. That'll bring the total award to them to $8,162.70. We got some updated information from the Quivira Council, Boy Scouts of America. Their request was $35,500. They were funded $25,500, leaving $10,000 in their food distribution. And the question that we had posed was what portion of that was allocated specifically to Sedgwick County residents, and Hope got some updated information. I think she has shared it. If not, I'll let her do it now.
Yep, I did send this out when I got it last week, but the applicant sent me back and said that for those hot boxes request that we had a few questions on, due to COVID-19. So he said 71.4% of the scouts that we serve come from Sedgwick County. And so that is the percentage that he used. So out of the 56 hot boxes, 40 of them was directly associated with Sedgwick County. And so that's how they came to that cost that they were asking us for. So it is directly related to only Sedgwick County residents.
Okay. So if there are no additional questions, I move that we move forward and approve the fund request from Quivira.
I'll second that. It's moved and seconded to fund an additional $10,000 to the Quivira Council, Boy Scouts of America. All in favor signify by saying aye.
Aye.
Aye. Any opposed? Same sign. So that motion passes unanimously. That would bring the Boy Scouts funding to their total request of $35,500. And then the third one, we discussed Catholic Charities last week. Funding was awarded of $15,125. There were questions about a vehicle and a building lease. Some questions around eligibility. Hope has received some information from Whit O'Brien's about that, and I'll let her share that.
Sure. The question, the communication I had with Whit O'Brien was basically I needed to ensure with the Catholic Charities that they weren't going to receive any outside funding from federal, state, or donations. And so I reached out to my contact at the Catholic Charities, and she said they will not be, have not, and will not be receiving any kind of outside funding or donations in order to cover those costs for the vehicle rental and the lease. And so with that, Whit O'Brien said that it does meet the criteria in order for us to be able to provide them with CARES funding.
Hope, can you remind us, so the total request was $56,855. Am I looking at the right application?
Let me pull that up really quick. That would have been smart for me to do that earlier. I didn't think about that.
Because we were asking a question just about one piece of this.
Correct.
Their total request was $56,855, and we awarded them $15,125.
Yeah,
So-
and the facility rent's $29,328, and then the vehicle lease is $12,402. Sorry, Brent, didn't mean to cut you off there.
That's fine. But what we heard from Whit O'Brien's was that that they agreed that since it was that it would be eligible because of being an ongoing expense during a closure or inability to use the facilities. But they did caution us about being careful with making sure we have proper documentation. And that, as Hope mentioned, is whether or not those rents have been paid from any other federal program or from donations specific to that. So that's one of the things that we'll pick up that burden as we look at those reimbursements to make sure that they would have received to pay for those is what they didn't get.
I'm good with approving this request. I'm just trying to figure out what the total, so this is just a subset of the original request. Have I got that right?
Yeah, it's $41,730. That's what we need to still approve.
Okay, I move that we approve exactly that amount. Oh, thank you.
$41,730. I'll second that.
Been moved and seconded to approve an additional award of $41,730 to Catholic Charities. All in favor signify by saying aye.
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 Any opposed, same sign? Hearing none, motion passes. Those are all of the funding requests that we currently have. So everyone has either been funded or have been, if they've been funded or denied, there's nothing left hanging in the abeyance. If any of you were watching the county commission meeting last Wednesday, in that meeting, County Manager Tom Stoltz mentioned that the hospitals were at or nearing capacity because of the additional COVID patients that are there right now. So they were in danger of having lack of bed space. Since that meeting, there have been a couple of conversations with the major hospitals, and we've received correspondence from Ascension and correspondence from Rock Regional Hospital. We haven't heard anything yet from Wesley, but there's a meeting later this morning with the two main hospitals and county leadership just to discuss bed capacity and different things of that nature. The numbers that we're hearing that they might be requesting would basically exhaust the remaining funds. We're a little over 5.9 million after the awards today. But we don't have formal requests through the portal at this point in time. We've got an indication of what they'd be looking for. If we get correspondence from Wesley, then that'll help us know kind of the total picture. And then because of the nature of that request, the urgency of that need as we're seeing cases increase, asking the committee if you've got some willingness to have a special meeting to discuss those hospital requests when we get final numbers, if any, from Wesley. The county commission they're open to having a special meeting on Thursday of this week to discuss any additional funding requests. We should know those by then. So that's kind of where we are right now, but the total requests that we're hearing right now would be in about a $6 million range. Haven't heard from Wesley yet. So if you guys are open to that, we'll let you know as soon as we know specifics, and because I would hate to wait another week. We'd be almost 2 weeks out.
Brent,
if we
this
take
is
it last Monday.
This is Melissa. I'd be delighted to meet in a special meeting to consider requests for funding from CARES from the hospitals. Last week, Lindsay sent us all some guidance on funding. I think this would be a great time to review that guidance as we contemplate, in advance of contemplation of proposals from the hospitals.
And this is Melody. I just want to make sure, I want to be aware of any other requests that may be in the pipeline. And I'm talking about applications when we extended the deadline, as to ensure that if we make the determination and decision to utilize the remaining dollars for the what we believe is going to be coming from the hospitals, that we're able to let whoever else may have submitted an application know that here's what we're potentially doing and the reasons why. So is there anyone else that's in the pipeline right now? I know we had requested for Sedgwick County or for staff to reach out to specifically the FQHCs and potentially other clinics. Was there a response from them? Who will we need to get back with?
Brent, I was just going to say, Melody, just from the perspective of applications coming in. I'm checking on a daily basis to make sure if we receive any that I get them out immediately. As of right this second, we don't have any additional applications. I'm not waiting at all. As soon as I find them, I'll send them, and I know Erin's checking as well. So that's my response to the application portion, but I'll let Brent talk about the other hospitals portion.
In the marketing efforts, our communications folks have visited with county people that work with those other providers. There are partners to ask them to do a specific outreach to those other healthcare providers or other partners in the mental health arena, whatever it might be, aging as well, because they've got those contacts and they can speak directly to them. So those efforts are ongoing, but at this point, we haven't seen applications.
Have we reached out to the state of Kansas for these regional hospitals?
For funding for them?
Yeah,
Okay.
all from all over the state in those hospitals and even out of state.
We have not made that. I think the hospitals, as I understand it, and what, that they're leaving no stone unturned, and they've asked for
Okay.
funding from the state. But I can't speak to specifics in terms of what they have received. I know
Okay.
that the Rock Regional Hospital that this committee awarded $150,000 to, they received less than that from the state, from Sparks funding, because it was based on some formulas from prior years, Medicare and Medicaid billings. And they've only been here since 2019, so they didn't have those prior years. So the formula skewed against them.
So I don't think we have a really good understanding of these hospitals. So let's have that conversation. We keep nibbling around the edges of it. One of the documents that Lindsay sent to us is CARES guidance that comes from an excerpt from, it says at the top, excerpt from municipal agreement, scope of eligible expenditures. And the first item on this list is eligible expenditures for medical expenses. So I'm just going to read off 1A, the medical expenses, such as COVID-related expenses of public hospitals, clinics, and similar facilities. 1B, expenses of establishing temporary public medical facilities and other measures to increase COVID-19 treatment capacity, including related construction costs. 1C, costs of providing COVID testing, including serological testing. 1AD, emergency medical response expenses, including emergency medical transportation related to COVID-19, and 1AE, expenses for establishing and operating public telemedicine capabilities for COVID-19 related treatment. So my understanding is that this means that CARES dollars can be used by public hospitals that are providing services to people who have tested positive for COVID-19, including costs for temporary facilities or things that they need to do in order to provide those services.
Okay, I appreciate that detail, and I know we're going to discuss it, but I need to go backwards for just a moment, and it has to do with your answer, Brent, to my question regarding the other facilities. I understood you to say that those that work with them or those that are on the ground actually have reached out and have made requests. And are you saying that we have not heard back from them? And this is specifically for the FQHCs.
Yeah, I'm not aware that we've seen any response. Now, they may be working on something with them, and it just hasn't made it back to the portal yet. But I'm about 2 steps removed from that actual conversation.
And there's no one currently in the current staff that's on this call that can speak to that either.
I don't know if, I don't think so.
Okay. All right. I just needed to be clear on that. And I appreciate you letting me, kind of butt in. So
Okay.
moving forward. Thank you.
Mhm.
Okay, so back to public hospitals. So my interpretation, and I need some guidance on this, is that if a clinic or a hospital wants to tap CARES funding to provide services to people who have been hospitalized for COVID-19, and as we know, the hospitalization rates are going up and probably will continue to, this is a permissible use of this funding. Is this interpretation correct?
I
Yes,
think,
and go ahead.
Jane's nodding her head yes, so I guess she's,
I think so, but I'm not an expert, so
okay,
from what you did, I would say yes.
Mhm.
yes. Okay, so however, so temporary facilities, potentially a hospital could pull together between now and December 30th when the funding has to be used. But construction appears to be off the table at this point because I can't imagine a major construction effort being completed by December 30th. Is that correct?
I think that's correct.
Okay, so temporary facilities, yes. Building something that can't be completed by December 30th is not possible. Unless it's some piece of the construction that potentially could be completed by the 30th, like demolition or installation of HVAC or plumbing or whatever. If there were some subset of the construction that could be completed?
That's a possibility. What they're indicating is that it's more, right now, a shortage of personnel as opposed to a shortage of space, that they can't fully utilize the space without getting some more people, some more boots on the ground, if you will, to help deliver those services.
That makes sense.
So that's kind of what they're talking about in terms of the requests that they would need is to get some additional people here because they can get them a lot faster. Balls and
It isn't everywhere in the country short of personnel also. I mean, from watching
what we
TV,
hear.
I would think so.
Yeah, that's what we hear for sure.
There's clearly a need to provide support so that staff can get relief and more staff can be added to deal with this influx of new patients. So that makes sense. What are some other potential costs that hospitals might be bringing to us besides personnel?
I think that's the big one that we're hearing right now. There's some potential for maybe some temporary facilities, but that's and I'm not trying to say that this is the request, but it could be something like the hints or something like that you see in other areas where capacity has already met capacity, or in some other facility. We're not hearing that yet. Right now, it's mainly being able to utilize what space they have, having enough people to deliver care.
Okay, that makes sense. Is there any additional guidance on the people who are served by these hospitals? So must the patients be residents of Sedgwick County?
No, not on the federal guidance, Chris, but it's something that we've looked for, but that's going to be a difficult thing to monitor. I think that, remember, we've got the window from March through December to capture those personnel costs. They may have already been incurred. Yeah, Kyle?
What's the, so we're talking about hospital expenses out of this pot of money. So nonprofit, right? Or would we get more money? So out of the 99 million, the county's portion was 60. We're not reviewing that obviously, but I don't know how much you guys have spent, but are you saying they would pull some out of that pot and we just review it, or are we still talking about, because a lot of your guys was for like public health as well, and you know, a lot for your own staff and hiring people. I wasn't sure if you're talking about this pot or if it's taking money from, because we're running out of time, obviously, at the end of the year, all that money's got to be spent. So are they saying they're going to combine from a couple of pots?
That decision hasn't been made yet, Kyle, but what we would, like right now, we're at 5.9 million remaining. If it came in at 7 million, then that'd be a commission decision on whether or not we reallocate funds in other areas toward this. So it's not, I mean, if this committee recommended an award that exceeded the amount in the bucket, then we'd give the commission place to have that, to find that money, if that was their will.
Gotcha, that makes sense. Okay.
Okay, and another question has to do with the hospital could be a for-profit hospital, it could be a nonprofit hospital, it could be a public hospital. The profit status of the hospital or clinic isn't a factor, correct?
That's correct.
Okay. Thank you. I think that answers all my questions. Lindsay, while you were off, we were going through the municipal guidance for medical expenses. And I kind of haltingly went through them, but if you could go through them more precisely, that'd be great.
You're muted. You're muted.
You're still,
Okay, can you hear me now? There's too many mute buttons between my phone and the computer. I'm sorry. Okay, so are you, Dr. Walker, are you referencing the subrecipient agreements, or were you talking about the Treasury guidance itself?
I did a dramatic reading from the excerpt from the municipal agreement, specifically section 1A, medical expenses, just to make sure we were clear about what hospital expenses count.
Fair enough. Okay, well, the beautiful thing of that is that it comes precisely from the guidance itself. So I am sorry I missed a dramatic reading, though. I'm sure it was riveting. So here is what non-exclusive examples of eligible expenditures are under the Treasury's guidance that we have incorporated into our agreement. So first, of course, for hospitals, medical expenses, such as COVID-19 related expenses of public hospitals, clinics, and similar facilities, expenses of establishing temporary public medical facilities and other measures to increase COVID-19 treatment capacity, including related construction costs. Although, of course, we know they've put out in the FAQs additional documentation of when construction can be appropriate. Costs of providing COVID-19 testing, including serological testing, emergency medical response expenses, expenses for establishing and operating public telemedicine, Then we get to public health expenses, such as expenses for communication and enforcement, expenses for acquisition and distribution of medical and protective supplies, expenses for disinfection of public areas and other facilities, expenses for technical assistance to local authorities, expenses for public safety measures undertaken in response to COVID-19, expenses for quarantining of individuals. Then they get to payroll expenses. Then they get to expenses of actions to facilitate compliance with COVID-19 related public health measures, which scanning through here, none of these appear to be anything that would be particularly helpful for the hospital discussion. And then finally, the catch-all that would be relevant, any other COVID-19 related expenses reasonably necessary to the function of government that satisfy the fund's eligibility criteria. So the guidance does also offer, the FAQs offer some guidance for hospitals specifically. And those FAQs do say that, because I did catch the end of that discussion, just validating what Brent has already said, it doesn't matter if it's for-profit or not-for-profit. It does say that the form of relief may look different depending on the hospital type, but it doesn't preclude either, whether it be a grant or reimbursement. The only thing we will have to be diligent in terms of is making sure that there's not also billing to some other entity to provide these same types of services, so not anything from Medicaid or Medicare or private insurance, et cetera. Does that answer your question, Dr. Walker?
It does, but it gets messy when you think about insurance, public insurance. So almost certainly some of these services are going to be paid for out of Medicare or Medicaid funds. So how do we think about that?
It would need to be a part of any agreement that we would enter into with them, that they would understand that to the extent there's services rendered, that could not be included in any billing calculation that was then passed along. So if they did say the $3.5 million worth of temporary staffing, well, those costs would not, they would need to figure out a way to back that out of their billing.
Okay, thank you.
Okay, do we have any other questions? What we will do then is, as we get a holistic picture of the need and the request, we'll get that out to you. Try to establish a time for a special meeting so that to the extent that we need to make an award recommendation to the county commission for their potential special meeting on Thursday, we'd be prepared to do that.
Sounds good.
Otherwise, we've approved this morning award recommendations of $54,640. We have just over 5.9 million, 5,905,287. Thank you for your time this morning. The time we're giving back this morning, we may take away later in the week.
Thanks, Brent.
But if nothing else, then I would accept a motion to adjourn.
So moved.
Second.
Moved and seconded to adjourn. All in favor, say aye.
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 No opposition. We'll consider it unanimous. And again, thank you for your time. We'll talk to you soon.